we'll get started. I'm Nickie Fickel. I'm from WellSpan Health, and we have Noel Purdy from Healthy Franklin County. And we're talking about the challenges and opportunities through COVID to access food. The faces of food insecurity, it can happen to anyone. You know, food insecurity is the consistent lack of consistent access to enough food for an active and healthy life. And it can happen to anyone at any time, you know, due to loss of job, you know, the pandemic, COVID-19 really made things, it was always a problem, but COVID-19 really made things worse. So like I said before, food security is having enough food to satisfy your hunger, as well as to meet dietary needs to live a productive and healthy life. And there are four components to food security. Is it the availability of food? You know, do you have enough nutritious food in your area? Do you have access to nutritious foods? And do you have the ability to purchase them or, you know, get to them? Utilization of the foods that you buy. You know, that could be factors such as storage. Do you have proper storage before they use them, before they spoil? Do you know how to cook those specific foods? And then do you have the sustainability to continue to access those foods and be more food secure? So hunger versus food insecurity. You know, hunger happens to everyone. You know, it's the sensation of craving foods that satisfy your needs. Whereas insecurity, food insecurity, is really the lack of financial resources to provide food for the entire household. There are different levels of food security. It ranges from low, very low food security to high food security. Very low food security really happens times during the year where you're not able to purchase food or access food that meets your nutritional needs. Whereas, you know, high food security is where you have no problems whatsoever of purchasing and accessing those nutritious foods that you need for a healthy lifestyle. And then there's in between, you know, and we can flow through these different levels at any given time. And food security is a complex problem. It's not easy. You know, primary drivers for food insecurity could be due to unemployment, poverty, homelessness, transportation issues, and they don't exist alone. You know, we have to make tough choices when we're food insecure between housing, between, you know, paying for food that our family needs and rent, or maybe medicine and food, you know. And like I've said before, these factors were always an issue, but it has just worsened through COVID-19. Just to give you some ideas of where Franklin County is in the poverty rates and the food insecurity rates, 2018, the food insecurity rate was 9.7. The estimated food insecurity rate for 2020 was 14.9. And you can see how we compare to the other regions within the WellSpan area. This graph is referrals made to 211. You can see in March of 2020, you know, we were kind of stable. And as the pandemic and COVID-19 happened, you can see the chart moving, you know, up and down and really not staying at a stable level. So how do families cope with food insecurity? You know, we have to, families that are challenged with food insecurity have to decide between medical bills, paying for medical bills, or maybe, you know, food. They have to decide between paying their rent or utility bills instead of buying food. People usually purchase quantity of food over the quality of food because, you know, healthy foods can be a little bit more expensive. Mothers might, you know, decide to dilute the formula and milk that they give their babies with water to save on cost. Maybe parents don't eat so that their children can eat. You know, maybe we send our kids with relatives, so or eat with friends instead of in the home. Food insecurity has a real big health impact as well. You know, inadequate intake of nutritious foods can increase chronic disease. It can cause negative risk for pregnancy outcomes, as long-term effects on children's social emotional health. And, you know, all of these things do increase our mental health as well, including depression, substance misuse, anxiety. And in that, you know, healthcare cost goes up. And that's one of the reasons that WellSpan and Healthy Franklin County really chose food insecurity as a top priority.
And so we also just wanted to provide some data from the national perspective about food insecurity. Nearly 1 in 4 households in the US experienced food insecurity in 2020. 10% of households experienced food insecurity during 2019, and that more than doubled during 2020. We're seeing more food insecurity in children, where in 2019, 5 million children were impacted by food insecurity. And then during 2020, or midway through 2020, more than double that, 5 million the previous year. So almost 14 million children impacted by food security in 2020. School lunch programs were struggling to meet the demand before the pandemic. And with the onset of the pandemic, there were a lot of challenges because a lot of students weren't able to access those nutritious foods because they weren't able to get to school. That being said, some schools and in Franklin County did provide the meals programs throughout the summer, but there were a lot of logistical barriers and challenges in trying to get those foods to families who needed them. Black families are twice as likely as white families to face food insecurity. Black and Hispanic families in the United States are disproportionately affected. 19% of Black households and 15.5% of Hispanic households experienced food insecurity in 2019. White Americans fell below the national average, with 7.9% experiencing food insecurity. 19 million Americans live in food deserts. So in Franklin County, just to give some perspective or kind of like an idea, downtown Chambersburg, the Southgate Shopping Center area, also a designation called Elm Street, is a food desert in Chambersburg, as an example. 38 million people used SNAP in 2019, and during the pandemic, it grew significantly, the use of SNAP benefits. So that's just kind of a overview and some insight into food insecurity in the United States. So wanted to back up just a little bit. You know, Nickie and I were asked to kind of fill in for Sonia Payne. Sonia is the coordinator with SCRC, Shippensburg Community Resource Coalition, and she also co-chairs our Healthy Franklin County Food Security Task Force. And unfortunately, she is not able to give this presentation today. So that's why Nickie and I are co-facilitating. But we are lucky that at our last Food Security Task Force meeting, Sonia was actually engaging with the group about this presentation that she was going to be making for you today. And so she had done some groundwork already. And so what I'm going to talk about here is a reflection of some of the discussion that we had at our Food Security Task Force meeting. So when we talk about, oh, sorry. missed that one. When we talk about when we talk about food security and how we addressed that during COVID in Franklin County, we did a lot of work through our task force. And when the pandemic came, just like many other organizations in the community, we were building systems and building interventions while in real time. And so we were really fortunate, like at the beginning, that we had a lot more participation in our food security task force because people were stuck at home. And so they were plugging into our meetings and we were collaborating and engaging. And so a lot of our work was designing things to address immediate needs in the community and then the changing needs over time with whatever was happening with COVID. And so one of the projects that we worked on was creating information pieces, flyers, databases about our emergency food providers in Franklin County. They were all trying to figure out, what their protocols were going to be, what their hours were going to be, if they were open. And so we had volunteers who mobilized very quickly, and they were doing outreach to the 40+ emergency food providers, a lot of them embedded in local churches in the community, and updating that information about their operations. And then we had other volunteers who were designing flyers, and we were breaking the flyers out by community, and then we were blasting them out through all of our networks as much as possible. So that was probably one of our most immediate things that we started to do, was getting the information out about the emergency food providers to the community. Another need that was addressed through our food security task force was connecting volunteers with nonprofit agencies and including emergency food providers. So we worked with United Way and setting up a portal with marrying up volunteers in the community who had some time with pressing human services needs and agencies that were addressing needs in the community due to COVID. Another project that we worked on as a collaborative through the task force was creating a grocery shopping program for seniors, targeting seniors who weren't able to leave, because of COVID, to go shopping for themselves, also utilizing the SNAP benefits. We were fortunate to partner with the Housing Authority, and I don't know if folks know Amanda Kiefer, but she is their resident life coordinator. I believe that's her title at the Housing Authority. And she was very central to us designing a pilot program. By the time we got the program off the ground, some things were, relaxing a little bit around COVID. And so while there was a lot of interest in the program, there were about 100 residents who were interested in using it. 10 people actually used it. But it was a really great example of pulling together resources in the community to address a need. And so we had like a good pilot in place. Since then, I think during that time also, the SNAP program allowed people to purchase food online. There was some kind of change also that happened over that time that impacted the use of our program, our senior shopping program. Another example of a program that we created to address an immediate need was an emergency food distribution process for members of the Hispanic community who had mixed documentation status, who were either COVID positive or unemployed or impacted adversely in some way due to COVID. And so key stakeholders from MILPA, Network Ministries, United Churches of Chambersburg came together, and SCAP to workshop a program, an alternative food delivery program, food distribution program. And so what they did is they raised money, over $20,000 or close to $20,000 was raised for this specific program. MILPA partnered with, Network Ministries did the fundraising part, and they were able to facilitate, as the 501c3 fundraising for this program. MILPA helped partner with SCAP and using their relationship with Central Pennsylvania Food Bank on ordering food. And then there were volunteers that were pulled together to make food boxes and deliver them. I'll talk about that a little bit more in the next slide. And then also, I mentioned before the backpack programs. And so Sonia was very instrumental in trying to pull together the backpack coordinators across the county. Also the in-school coordinators, and then the partnering coordinators, like say the churches that run, and organize the food kits and pull them all together and brainstorm and figure out the best way to get food to families. So that was also an ongoing project through COVID, through the task force. So lessons learned from these programs, and simple is best. And in particular, with the emergency food program I mentioned before with MILPA, it was very resource intensive, but not very efficient. I mentioned a couple of key things that, at the outset of it made it seem like it was going to be, it made sense, which was the fundraising piece. It's kind of easy to raise the money. We're going to piggyback on a relationship that SCAP has with the food bank. But then the time and the energy put into coordinating the volunteers, getting the food orders in, picking up the food from SCAP, finding a place to house the food. I think they brought it back to Network Ministries, coupled with knowing that they needed to source also some culturally appropriate food for the Hispanic family. So they would go to Mercado Latino and use some of the funds that were raised. So they made sure they had some culturally appropriate food in the food boxes. And then they delivered the food to the families. And many of the families lived outside of town, on the edge of town. And so the group that did, most of that work paused and they were like, can we do this better? How can we do this better? And so the conclusion was, let's just give them money. Let's just give the families the money so that they can purchase the food that they need for their families. And so that was something that, we learned throughout that process. It's also something I've heard a lot through the Circles program and SCAP, is that we need to trust people to spend their money wisely. And low-income people are often the best budgeters. And so that case study in real time during COVID definitely reinforced that practice and principle that the Circles program preaches as well. And another lesson learned was that collaboration is essential. We had so many different stakeholders involved during COVID, and we still do. We had lots of information sharing that we could share if we were doing like a project to get information about public health mitigation out. And in fact, we did, like through our health disparities task force, we literally printed 1,000 flyers, went to downtown Chambersburg, because at that point in time, we knew that there was a cluster of COVID cases at the beginning, which is predominantly where our Hispanic community lived. We literally canvassed the neighborhood. So when we canvassed the neighborhood with flyers about, what phase are we in and how do you protect yourself and how do you get a COVID test, we also had flyers about emergency food providers and where can you get food, call 211, mental health resources. So we were threading together other groups within Healthy Franklin County and trying to be efficient in getting resources out to those who are being impacted by COVID. Another lesson learned through this process was that we were able to break down silos between the community and nonprofits, which is really important in a time of crisis when the safety net is being elevated to address needs, more pressing needs in real time. And then of course, our collective impact approach through Healthy Franklin County. That's a whole nother presentation, and I'm happy to give that to you if you're interested, to talk about Healthy Franklin County and what we do. But it's really partnering and leveraging resources in the community through our approach. And that being said, also, we continue on as we're coming out of COVID. We're continuing with our food security work. It's still an issue. And our focus is still supporting the backpack programs, looking at nutrition supports in the community, WellSpan clinical interventions, and then starting to elevate our engagement with policy and advocacy, because that's a whole nother space that has probably more impact, it does, than any of the interventions that most of us are doing at this point in time. And so that's work that we're starting to get into with food security.
And like I said before, you know, food security or insecurity was a priority before COVID. You know, it just got heightened when COVID hit. So some of the priorities through a WellSpan lens, you know, to build awareness and identify needs related to food insecurity, really assisting with the partners. Like Noel said, collaboration is key. Assisting, you know, partners to identify gaps and support their efforts to access quality food. Build internal awareness campaigns as well as community awareness campaigns related to food insecurity. Then we're also screening our patients for food insecurity. And we even did this screenings at the COVID testing sites as well. That was one thing that was implemented to help get people access to the food that they needed. Another priority is, you know, support and sustain solutions. Partner with lead organizations, distribution networks to close those gaps and build capacity and promote innovation. Then also really equipped our case management team and our ambulatory care teams to navigate food resources and referrals in the community. Respond to immediate needs of patients that are food insecure, really seek those and secure those partnerships with community organizations to have a seamless referral system, and then remove barriers such as transportation for patients that need the food immediately. Then also, of course, responding to patients with chronic disease that are at risk for food insecurity, really providing the resources and tools for our own employees to educate patients on community resources, as well as, you know, budgeting and, you know, the programs that are out there that offer the healthier foods to get proper nutrition for those patients that are at risk for chronic disease. We did expand our Market Bucks program, or we are expanding our Market Bucks program to Franklin County. You know, this program really is a multi-track approach. It's to help improve the care and treatment of our own patients, as well as promote economic stability with local farms and support our local farmers. Some of how this program works is, you know, when staff identify patients that are food insecure, we give them Market Buck vouchers for local produce markets in our area. So, you know, go support those markets. Some of the markets that are participating this year are Waynesboro, downtown, and we tried to hit every region within Franklin County. So Waynesboro Downtown Market, the Shippensburg Open Air Market, as well as Maplewood Produce in Shippensburg, Jim's Farmers Market, North Square Farmers Market, Andrews Farmers Market in St. Thomas, as well as Shady Grove.
And so this is a snapshot of some local resources, and I'm going to spend some time on the map, but just to take a look at all these, there's some national resources, CDC, Department of Agriculture, Feeding America, Central Pennsylvania Food Bank, Gleaning Project. We also have some local resources in addition to SCAP and the Gleaning Project on our Healthy Franklin County website at Partner Resources, where Wilson College students created some printables and some posters that you can use, or if you want you can get posters from me. If anybody wants posters, I can get them for you that promote food providers, emergency food providers in the region. But I did want to take a moment to take a look at our mapper here. So in partnership with Franklin County government and their planning department, our food security task force put together resources in the community. So we have emergency food providers tab. And so if you click on the green icon, and then it pops up information about that respective emergency food provider, and then direct contact information. So this is one way of connecting individuals with resources in the community. We also have a tab for the backpack programs. And these primarily are the schools where the backpack programs are distributed in Franklin County. And so you can contact the schools directly about those programs. This is data about the National School Lunch Program, and you can click on each icon, each pen, and see specific data about how the National Food Program is used across the school districts in Franklin County, which is, when we talk about policy and interventions, right? So this is like a really good example of a national policy, basically. So the federal government supports the idea of making sure that children can access nutritious and healthy food through the public school systems. And for those that are low income or meet the income requirements, they can get breakfast and lunch, healthy meals through the public school system. Because we know that if kids are hungry, they can't focus on school. So there's a barrier there that is being met through a national scale policy. And in Franklin County, if you actually look at the data, poverty is a significant issue in Franklin County, and a lot of families use this program. So that's just kind of an example of policy and intervention and how it improves families in our own community. Also, we have a map of community gardens in Franklin County. Some of these are public gardens, some of them are not. Some of them are educational, like the school programs, the school gardens. Actually, our community garden work group is updating this data right now. So this map we released, I don't know, 2 years ago, I think. We may have released this 2 years ago. And so it's some of the data is due for an update. And so that's actually a project we're working on right now, one of our work groups under our task force. Markets tab, these are markets in Franklin County that have fresh produce available at the markets. And yeah, and you can click on, and we actually, interestingly, in downtown Chambersburg, we have a lot of Hispanic markets that cater to different populations in our community. SNAP acceptance. So this tab, again, we have a little legend over here that talks about the different types of businesses that accept SNAP in Franklin County, and then you can click on it and the contact information is there. And then the food insecurities tab is just kind of an aggregate of all these layers, showing where the food resources are in Franklin County through different programs. And there's a resource tab here with just information about promoting this resource. Okay, go back to the PowerPoint. Can you see the PowerPoint? Okay, great. Oh, okay, well, and now we're kind of at the end. So if you're interested, and we can talk a little bit more, I mean, this will wrap up kind of our presentation part, but we do want to engage in conversation. So this is Nickie and I. If you're interested in getting more information about anything that we've talked about, you can reach out to us direct. If you're interested in getting involved with the Food Security Task Force, we meet every other month. And our next meeting is is June 22nd.